Hello everyone, myself Meet Sevak from B Physiotherapy. So today we are going to discuss about the scapula bone. So this is the scapula bone, which is flat bone. To hold it in anatomical positions, we have to take care about two things. First, scapula have two surface, costal surface and the dorsal surface. Glenoid cavity which will present laterally. This is the glenoid cavity which is present lateral side of scapula, and this is the lateral side of scapula. By taking care of these two things, you can easily identify the sides of scapula. Now let us see some features of scapula. It is the flat and triangular bone situated at upper part of the posterolateral aspect of thorax. Scapula have four parts, one body and three processes. First, spinous process. Second, acromion process, and the third one is coracoid process. This is the spinous process, this is acromion process, and the third one which is coracoid process. First, body. Body have two surface, three border and three angles. The costal surface and the dorsal surface. This is the costal surface and this is the dorsal surface. On the dorsal side, we can see five muscles attachment. First one, supraspinatus fossa. Here the supraspinatus muscle which is attached, infraspinatus muscle which is attached over here. In the upper two-third, the teres minor muscles which is present, teres major muscle which is present from here, and from the inferior angle, latissimus dorsi muscles is attached. Here, from here the teres latissimus dorsi muscle which is present, and these all are the five muscles attachment of dorsal side. Let us see about the borders of scapula. Superior border, this is superior border, lateral border and the medial border. On superior border, we can see one notch called the suprascapular notch. From here, the suprascapular artery and the suprascapular vein passes. From superior border, one muscle attaches inferior belly called omohyoid muscle. From here, the omohyoid muscle originates. Now, lateral side which is thick below the glenoid cavity. This is the lateral side which is thick below the glenoid cavity. One tubercle is present which is called the infraglenoid tubercle. This is infraglenoid tubercle. From here, the origin of long head of tricep originates. Here, the origin of long head of tricep is there. Now let us see the medial border. This is the medial border. It is thin. From medial border, four muscle attachment which is present. From costal surface of medial border, serratus anterior muscle which is attached. From costal surface, so this is costal surface. From here, the border from costal surface, from here the medial border called serratus anterior muscle which is attached. Dorsal surface, and on dorsal surface the insertion of levator scapulae. From here, the insertion of levator scapulae, rhomboideus minor originates from here, and the rhomboideus major muscle insertion from here. Now let us discuss about the angle of scapula. Superior angles which lies over the second ribs, inferior angle which lies over the seventh ribs, and the lateral which is glenoid cavity, and the glenoid labrum which is over the glenoid cavity. Now the processes. There are three processes. First one, coracoid process. This is coracoid process. From the tip of coracoid process, two muscle originates. First one, short head of bicep brachii, and the second one which is coracobrachialis muscles attached. Insertion of pectoralis minor muscles is insertion. Now attachment of coracoacromial ligament present between the coracoid process and the acromial ligament. Coracoid process and the acromial ligament. Acromion process. Between this, the coracoacromial ligament which is present. Coracoclavicular ligament and the coracohumeral ligament. Now let us discuss about the spinous process. Spinous process which is having two surfaces, superior surface which is called supraspinatus attachment and the inferior surface which is called infraspinatus attachment. Now spinous process which is having three borders: anterior border, lateral border and the posterior border. Now let us discuss about the spinous process. Spinous process is having two surfaces, superior surface and the inferior surface. Superior surface is having the attachment of supraspinatus and the inferior surface is having the infraspinatus attachment. And there are three borders: anterior border, lateral border and the posterior border. In anterior border is having the attachment of dorsal surface, and lateral border which is having the spinoglenoid notch, and the posterior border it is having the insertion of trapezium muscle. Acromion process have two surface and two borders. The spinous process extends and forms the acromion process. Acromion process have two surface: the superior surface which is rough and the inferior surface which is smooth, related to subacromial bursa. Borders: medial border and lateral border. In medial border there is attachment of trapezius muscle, and in lateral border there is attachment of deltoid muscles. It all was about the scapula bone. Thank you for watching this video and have a nice day.